Now, speaking about technology, do you think technology it's a tool that can help alleviate this crisis?
Well, for sure, I can think of 3 ways right now of how technology can help alleviate the staffing crisis and improve healthcare in general. 1, virtual care. If there's one thing to come out of the pandemic, it's virtual care. I appreciate not all visits with a doctor or nurse practitioner can be done online, but the pandemic has shown us that some consultations can take place online efficiently. I know residents in more remote northern and rural areas that appreciate not needing to travel long distances to see medical professionals in urban areas. For example, last year, at one of our National Finance Committee meetings, I asked officials from Health Canada about federal investments in virtual care, and we were told that provinces and territories quickly adapted their approaches at the beginning of the pandemic to support virtual visits. We went from fewer than 5% of visits being virtual to now in the range of over half of the interactions with healthcare providers being done over the phone, video conferencing, or virtual means. So virtual has become very, very important in healthcare. 2, artificial intelligence. 5 years ago, the Senate's Committee on Social Affairs, Science and Technology published a report on integrating robotics, artificial intelligence, and 3D printing technology into Canada's healthcare systems. The report highlighted how automation will be essential in making our healthcare system sustainable and will play an important role on and in the future of training and education, services to rural and remote regions, home care, and personalized medicine. So that's very important in all those sectors. And the impact of artificial intelligence is obviously not unique on the healthcare sector and not unique in the healthcare sector. So 3, data. I think data is so important. We all know the importance of data. In a hospital setting, for example, data can help them prepare for future staffing and care needs. We expect more cancer patients in the years to come based on the data and current trends. So hospitals can prepare for the increased demand in care and services. We also know how important data modeling has been throughout the pandemic in helping inform decision makers and Canadians. So it's been extremely important. So that's an issue that we have to bring attention to.
Absolutely. And James, do you have comments? No?
Yeah, there's no question. I love what you said. I'm a big proponent of technology. I worked in technology for many, many years. AI is huge. There's no question that it's already being shown. I know people that work in virtual care that have platforms or models that do everything from being able to assess a wound to knowing certain conditions that just save a lot of time. And I think a lot of that is the same thing with why we use models like this being Teams, as opposed to Zoom and so many others that are out there. There was a time where people didn't use these platforms much at all. And then the pandemic forced them to go outside the comfort zone and embrace technology. So, that's on a smaller scale, but what's going to happen, you see now, is when things get to the point where we can really get back together again, I think a lot of people will assess this and say, well, do I really need to go to this conference? Maybe I can do this all remotely. Now, I'm a fan of networking and I absolutely want to go to that conference, but if it doesn't make sense when you have a lot on your plate, let's say, because we all know everyone gets busy and busy, we have to embrace technology. We have to. So it's the same for us. We're all about leveraging a unique platform that just totally streamlines and shortens the whole hiring process in healthcare.
Well, James, well said. We're a prime example of that. Myself and yourself. We met over LinkedIn, I think it was, and a message here there, and here we are on Zoom, and we're trying to solve the global health problems and the health issues, right? So I think it's so important. You know, I always say a good conversation is 80% eye contact, and Zoom, you know, you're looking all over the screen, and where are you looking? And you're looking at, you know, there's three individuals on the screen, so where do you look for the eye contact? But there's certain issues over Zoom. Obviously, it's not the same. But I think it's in healthcare, it's a plus. I think technology has become a plus for many, and you know, face to face is always preferable when you can. But I think a lot of the future meetings will be done over Zoom, and when we can, and the virtual healthcare is a big plus, because you send a picture or a photo, an email, you get a quick response, and I think the doctors will be able to serve many more patients that way, and for minor issues, obviously. For major issues, they'll have to see you, they'll have to go to the hospital. I mean, we all know that.
100%.
Absolutely. And finally, we would like to know, I think James already gave you an introduction of a platform. I'm not sure if you had some time.
Yes. I've really looked into your platform, and first of all, I want to say kudos to you and to your team for coming up with the concept of caring support. I think your platform shows a lot of potential and could certainly help in streamlining the hiring process for healthcare employers by helping them connect more efficiently with prospective employees. I mentioned it so many times. We need resources. And I think your platform can help accelerate the hiring process and cut a lot of red tape. I have no doubt caring support could have been quite useful in the early stages of the pandemic, as provincial governments sought to hire more staff under short notice. They had very little notice to hire staff, and your platform would have helped big time. In 2012, years before I was appointed to the Senate, because as you see, I'm a young senator, the Social Affairs Committee conducted a review on the 2022 Health Accord and published a 122-page report entitled Time for Transformative Change. And I joke that I'm a young senator because this pandemic has aged us, has aged all of us big time. So I feel the age, sometimes the aging process has kicked in for many of us. So I like to joke about it. But there is an interesting passage in the report worth quoting, which 10 years later is as relevant as ever. Senators wrote, many witnesses told the committee the innovation-based transformation is needed to achieve and sustain the healthcare systems. These witnesses were unequivocal in their insistence that any increases in healthcare funding be used to promote change rather than maintain the status quo. So promote change, funding should promote change. They therefore argued that governments need to focus on creating incentives to transform healthcare systems. The committee heard that there is a real appetite among healthcare professionals to truly transform the way they do business and achieve lasting reform. The committee believes that the time for this transformative change is now. I hope hospitals, managers, and HR experts will not seek the status quo and be receptive to your platform and any other innovative technology or technologies. Innovative technologies are so important, and for that matter, consider ways caring support could be integrated into its own business model. I'm optimistic that they will be interested and consider, after all, innovation, technology, and research, and consider that they have been at the heart of medical advancements and breakthroughs. So that's very important that they consider that and acknowledge that they have been at the heart of breakthroughs. Innovation is so important, and innovative technology is key, and your platform fits right in to innovative technology. So kudos to that, and congratulations for what you have done, for what you have accomplished, and thank you for all that you will do for the healthcare sector moving forward.
Thank you so much for that. We really, really appreciate your words.
Yes, thank you. It's funny because we did, I'm going to say recently won an award in innovation. And, we are basically headquartered in London, Ontario, so we're a Canadian company. And, as much as these are wonderful things and a lot of these compliments that, people extolling our virtues is wonderful, it's not about us. We built this for healthcare. We built this to make a difference. And it's a healthcare platform only. So even though we will move into other areas, that it's always going to be healthcare. You're not going to see construction, manufacturing, sales, retail, whatever on this platform. Its focus is intended to make a big difference in healthcare. And as we continue to evolve and move more into a community-oriented platform, then it's going to make a big difference for people as they need to see everything that they need in healthcare in a 9-to-5 type capacity. So, thank you again for the wonderful words. I really appreciate it. The last thing I'm just going to say that I think what's really great about caring support, and the reason we get so excited about it, is that it's the reaction from people when they see it. It's the, oh my God, like, wow, where have you been? This is so amazing. What's so great though is it's extremely easy to use. And yet it's intuitive. And it just puts people together. School being on the platform, that teach health sciences of some form. The candidate, of course, which is a free experience, and the healthcare organization, hospitals, community care, in-home healthcare providers, etc. And we will move beyond long-term care. We work with a lot of long-term care and retirement. So as this becomes more diverse, before you know it, you'll see physio in there. You're going to see the dental industry in there. You're going to see so many other areas that are all related to health, because every single one of them is struggling right now with staffing. And we're here to make a difference. So thank you again.
And that's what we need. We need platforms that will make a difference. We need the innovative technologies that will make a difference, such as your platform. And so thank you for being there. And I think that I hope that people are listening, and that we move forward with such technologies, because they're much needed in the healthcare sector.
Absolutely. Thank you.
Well, thank you. We won't take more of your time. So
thank you all, and it's been a pleasure. And wishing you all once again a happy New Year and the very best in the new year. And let's go back to work and keep working, and hopefully we'll see better days.
Yes.
Hopefully.
Yes. Wishing you all the best.
All the best. Take care.